Preoperative clients require attention on many levels to ensure client safety. There are many complications a client may experience, such as wound dehiscence. Dehiscence is a separation of the wound or incisional edges developing on the surface layer and can span the entire length of the wound. This condition mostly commonly occurs after a client has abdominal surgery.
Come in.
Good afternoon. My name is Makia, and I will be your attending nurse. I'm here to go over some post-op information that you'll need to be aware of during your discharge care at home. Is now a good time to talk?
Yes, please.
Okay, good. You recently had hernia repair surgery, and with this type of surgery, we like to inform patients of wound dehiscence after surgical repair. Dehiscence is the complete or partial separation of the suture line and underlying tissue that occurs when a wound fails to heal properly. Typically, complications occur when there's been an injury or trauma to the surgical site. The surgical area or muscle may become weak or due to the suture placement breakage.
What is the suture placement breakage?
That is when the sutures break open, come apart, or separate.
Okay.
Other factors contributing to this complication are infection of the surgical site and the use of corticosteroid medications in high doses, such as prednisone, hydrocortisone, and dexamethasone.
I don't take any of those currently.
Good. Let's go over what some signs may be if this were to happen. Those signs are an increased redness, pain, fever, swelling, and bleeding. Of course, you're going to have some swelling and redness, but if it's warm or hot when you clean around the site or bleeding through the dressing, then you'll need to call the MD number listed on the discharge paperwork.
How do they fix this?
Some forms of treatment for this condition are more frequent dressing changes, a change in the dressing prescription, such as open to air to promote tissue growth, antibiotics may be prescribed, or additional surgery to remove the infected, damaged, or dead tissue, or the replacement of new sutures or mesh to help close the wound. Another form of treatment is the use of a wound vac. Another complication for patients with this type of surgery is evisceration, which is a protrusion of the organ through the surgical incision. With this complication, immediate surgical repair is required. This is a lot of information. Do you have any questions for me, or can I go over anything in more detail?
Yes, what is a wound vac?
It's a bandage-like dressing that connects with a tube to a vacuum machine, and the pump sucks up the wet drainage away from the wound.
Okay, so before I go, just to make sure with my surgery, wound dehiscence is when the surgical site opens, and during my dressing changes, I should be aware of those increased signs and symptoms of bleeding, warmth, and foul-smelling drainage. Those are some urgent signs of surgical complications and warrant a phone call to my MD.
Yes.
Thank you for the information and your assistance.